Okay, so we're going to perform a general examination of Dougie here. I'm just going to talk you through that process. Obviously, when you come here with your pet, you see me doing lots of things, you're perhaps wondering what it is I'm actually up to. So I thought it'd be nice to have a video talking you through the process because it might be of interest to you. So obviously, when you arrive in the surgery, the first thing we normally do is weigh the patient. We won't do that in this video because unfortunately, because of constraints of space, we haven't got the scales in here today, but normally that would have been done. I would compare the weights from previous visits, make sure we're not losing or gaining weight in an inappropriate fashion. And then we'd move on, get a bit of history from yourselves. You know, are they eating okay? Any sickness, diarrhea, any changing in drinking habits? These are all very important observations. And then move on and have a look-see over the patient. So moving on, I usually start with the eyes. So we sort of lift the head up, a little check of the nose first. So a little check to see if we've got any signs of any discharge from the nose, any discharge from the eyes. Look at the eyes. Make sure the eyes are clear. We like to see nice white eyes, so the sclera is clear. Checking the coloured part of the eye, the iris, making sure the pupils are even on both sides. Checking the cornea, which is the front part of the eye, the clear part of the eye. We're looking really for any marks, discoloration, any blood vessels growing in that might indicate problems. Lots of problems occur in eyes, so always spending a fair bit of time there. We're then going to check behind the eye, just by pressing down there. That brings that third eyelid across, which I can then look at to see if the colour is okay. By pushing the globe back into the socket, I'm just making sure there's nothing behind the eye. Sometimes we get patients with lesions behind the eye. They can be tumours or abscesses and nasty things like that, and we just want to make sure that they're fine. Having a look inside the oral cavity. So obviously we're looking really at the teeth here. In a young pet, we'll be checking the bite, making sure the jaws are aligned. In an older pet, we're looking for disease, so typically tartar accumulation, gingivitis, broken teeth. Staffies, like this guy, they'll often bruise the pulps of their canines. That discolours the canine, so if you see a blue pulp cavity, that's what's happened. It's a bruised pulp. Check both sides, all fine here. Nice pink, healthy colour to the gums. So no sign of any anemia, no sign of any jaundice. And open the mouth up and have a look inside. Again, depending on the breed, sometimes we get more decay than others. Labradors are known for decay of the back teeth, which we're not going to be able to demonstrate here very easily because he's moving around a bit because he's not too keen on me doing this. Well done, have my fingers back, thank you. Okay, then we're going to check lymph nodes. So we've got the submandibular lymph nodes, prescapulars, axillaries, inguinals, and popliteals. Just making sure they're normal in size. Some of these you can feel, some of them you can't. If there are any abnormalities there, we've got to consider why they're abnormal and a variety of reasons why that can occur. In the submandibular area, it's often due to dental disease, and other sites, it can be a sign that they've got something a bit more sinister. So that would be something we'd want to investigate. Quick check of ears. So we're just going to have a look-see externally, making sure we've got no sign of pinal disease. Looking down into the ear, see if we can see anything. Quick sniff, any nasty smells or anything like that. Nothing here, fortunately, on Dougie. So that's all good news for him. And then we're going to have a listen to the chest. So Michelle's just going to hold his jaws shut. So it just cuts down the puffing and the panting, so I can have a good listen to his heart to start with. I'm particularly interested in listening for murmurs and irregular heartbeats. That seems okay, so we're just going to feel his pulse at the same time. So we're feeling the femoral pulse in that back leg, which you might not be able to see too clearly on the video. And I'm checking to make sure we've got a nice strong beat and a nice strong pulse. The two coincide, which they do. Okay, you can have a puff and a pant. So we're going to let him have a little puff and a pant there if he wants to. I'm just going to listen to his lungs. And basically we're listening to crackles and wheezes primarily, or any dullness in the chest, which can sometimes indicate any problems. Moving back to his abdomen, I'm just going to reverse him back a little bit. There's a good boy, well done. Some dogs aren't too keen on having their abdomens palpated, but those that are, this is a very valuable part of the examination. It gives me a chance to feel for lumps and bumps, really. I'm looking to see if we can feel any organs that are enlarged, any pain, any discomfort. And we need to spend some time doing this. I'm I'm pleased to say that Dougie's feeling fine in here today. So we might detect if he had it, an enlarged liver, enlarged spleens, things like that. Pain at the front end of the abdomen might signify pancreatitis. Going back towards the bladder area, we might see discomfort if he had stones or cystitis. That's all fine. Okay, I'm just going to check the anal area, which I won't turn around for this. So we're looking at the anal glands. We're looking for anal adenomas and lumps and bumps, which dogs sometimes get, or male dogs sometimes get. Quick feel of the testicles if he had any. This little chap hasn't got any. And then we're just going to have a quick look at his coat. Looking for signs of ectoparasites, looking for signs of redness and soreness and crusting. Any areas of alopecia. All looks fine. Okay, and then we're just going to round off, little check of nails. Particularly in older patients, they do sometimes need clipping, but they're fine. And that's the clinical examination. As always, if having watched this video you have any questions, or if you encounter any difficulties performing the procedure, then please phone or email the surgery. We're here to personally help give you the very best advice and treatment possible for your much loved pet. Thanks for watching. Any feedback regarding this video will be very much appreciated.